Welcome to Careers in Discovery, your window into the world of biotech leaders. On each episode, we interview the industry's leading executives to understand how they built their careers, what they've learned along the way, and the advice they'd give to their younger selves. Next up on Careers in Discovery, I'm with Erica Barnell, Chief Medical Officer and co-founder of Geneoscopy. Erica and I talked about Geneoscopy's novel approach to gastrointestinal health, her development from student to entrepreneur, the challenges of shifting from product development to commercialization as the business grew, and how she's navigated the balance of leadership, family, and growth in a dynamic, fast-moving startup environment. So I am back on Careers in Discovery with Erica Barnell of Geneoscopy. Erica, welcome to the show.
Thank you for having me.
Great to see you. So Erica, tell me a bit about transforming gastrointestinal health and the work you're doing at Geneoscopy to start with.
Absolutely. So I'm the Chief Medical Officer and the co-founder here at Geneoscopy. What we do here is we have developed a platform technology to evaluate RNA biomarkers in stool samples, and we're using those RNA transcripts to better diagnose, monitor, and treat gastrointestinal disease. Our lead assay has mostly focused on colorectal cancer, but we also have a lot of pipeline in inflammatory bowel disease and familial adenomatous polyposis, celiacs, IBS, other GI diseases like that.
Yeah, interesting. And a lot of these diseases that are kind of increasing in occurrence, right? They're increasing in prevalence.
I mean, if you ask anybody, I think anybody's, mentioned that they've experienced gastrointestinal distress. And what's really unfortunate is every time I give a talk or present kind of the research that we're doing or the work that we're doing here at Geneoscopy, somebody will come up and say, my mom had colorectal cancer, or my brother, sister, daughter, whatever it is. And like you're describing, that story is becoming, unfortunately, more frequent.
Yeah, absolutely. And tell us a bit, I appreciate some of it will be proprietary, so don't give away any of the family secrets, but tell us a bit about the approach. Tell us a bit about what makes what you're doing different.
Yeah, I think, it's kind of a simple process, I would say. Healthcare has transformed over the last 20 years since I even, started thinking about entering the field of medicine. And what we've noticed is that people have a lot more knowledge about healthcare. They have a lot more access to their own healthcare and to information about diagnosis and treatment. And so what we do at Geneoscopy is try to meet patients where they are. We ship a collection kit directly to patients' homes. They have a bowel movement, like we do every day after our coffee, and just ship it back to the lab, kind of no fuss, no muss. And we evaluate the signals that are derived from the colon and the small bowel, and we query to see if we see anything abnormal. And then we provide that information back to patients. So it's a really easy process for patients, and we get a lot of information out of something that you would normally just flush away.
Yeah, absolutely. And I'm always interested in the origins of companies and sort of where these ideas have come from and how they've grown. And I suppose you've been, this has been a venture for coming up to 8 years now, or just over 8 years. So you're well into it. Tell us about sort of how this became a thing, how Geneoscopy came to be.
Yeah, it's so, it still feels a little surreal when, people touch on that it's been 8 years that we've developed a successful company. I still view us as a startup, even though we've been doing this for nearly a decade, and we have, a huge number of employees now and a big lab and coffers are full. But, we started with three students and an idea. I was developing some really cool technologies in a microbiome lab at WashU here in St. Louis. And I matriculated to the MD PhD program in 2014, just about a decade ago, and I started seeing some of these, really bad cases, these really young patients, moms, with little kids that were getting diagnosis of colon cancer in late stage, even though they were 48 years old or 52. And when you ask these patients, why didn't you get a colonoscopy? The most commonly cited reason was, I just didn't have time. I couldn't time off work. I don't have great insurance. There's no one to drive me to and from the endoscopy suite. And so I thought to myself, why don't we build something for these people? These moms, these, dual working couples, people who are younger, people who might prefer a non-invasive approach. And that was really the foundation for Geneoscopy.
Yes. Yeah, and I suppose there's that internal debate that happens, isn't there, between, well, I know this is going to be uncomfortable versus I might have this thing, but I might not. And the time it takes, and I suppose sometimes you don't really want to know, right? And that's not the right approach, but.
And I think, even beyond that, patients, I'll always say, I knew I needed to. I knew I had to get a my GI told me, or my PCP told me, has been telling me for years. And I think just making time for it, and, in the back of your mind, you've got so many things going on. You got to pick the kids up from school. You got to go to the PTA. You got to go to your work. You have a project. You got things. And it's a lower on the priority list to take care of yourself. And so what we're trying to do is make that activation energy really small.
Yeah.
Kit shows up at your door. Somebody calls you, walks you through the process. You go to the bathroom anyways, like I said. It comes back to the lab. And, most of the time you're clear for another 3 years. So we just want to make it kind of part of people's lives so that, they don't really have to think about it so much.
Yeah, absolutely. And you mentioned as well that a lot of the diagnoses were coming too late, and I suppose this is part of it as well, is getting that early warning. And I guess as well, when you have whether it's a chronic condition or a condition that's sort of slowly progressing rather than acutely progressing, you kind of get used to not feeling great, right? And so it becomes less urgent, I suppose.
Yeah, a lot of people even don't even have symptoms, right? You can have asymptomatic stage 4 colon cancer. Asymptomatic stage 3 colon cancer is very common. Right. And the stage 2 and stage 1s, that's the most likely. And so these are people who otherwise feel entirely healthy, well. And, like you're describing, they're average risk, asymptomatic people that are just walking around and trying to get everything done in a day. And I think, again, it's hard to get to the doctor's appointments. It's hard to do all these things. So being able to do stuff at home and having access to your healthcare at home is really great. Yeah,
absolutely. And I'm assuming, like most cancers and like most conditions, catching it early makes it much easier to treat, I would assume.
Yeah, I mean, our label that we have for ColoSense is both precancerous lesions and cancerous lesions, which I think is very important. If you catch an advanced adenoma and have it removed, the 5-year survival rate is 100%, right? You never get cancer. And so it's actually preventative.
Yes.
Also have a label for detecting stage 1 and stage 2 cancer. In our most recent clinical trial, we had 100% sensitivity for stage 1 cancers, which is really important too, because the 5-year survival rate, again, for that is 95% or over 95%. When you start getting later stages, stage 2, stage 3, stage 4, the 5-year survival rate can drop to 11%. And so it's really important to both prevent cancer and catch it in its earliest disease so that you can just resect it and never have any problems again.
Yes. Yeah, absolutely. So we'll come back to the work you're doing now. But I want to talk a bit about you, Erica, and your career and your path. I am always interested in kind of the early days of when people decide to do certain things with their lives. why medicine? Why science? Why healthcare? Like, why this path for you, do you think?
That's an interesting question. I think there's two types of medical students. They're the medical students, my peers that have always known they wanted to be an orthopedic surgeon since they were 4 years old, right? And they're there to learn to cut and sew, and they go through everything because they have to, but, eyes on the prize, and they're really waiting for that opportunity to kind of live out their dream as a surgeon or a doctor or whatever it may be. And then I think there's, the Eliza Thornberrys of the world, where, and that's more like my phenotype, I'd say, where I was just really interested in science. I was really interested and curious about disease. I was really invested in my research. I took the MCAT on a whim, just my advisor told me to, and I did okay. And I applied to a couple of schools and got in. And so I kind of fell into it just because I was passionate about science and research and medicine, and invested in doing those things and just following my feet. And it kind of led me to where I am today. So I wish I had a more profound origin story, I would say, but I think it was just curiosity.
Yeah, no, that makes sense. And so you started studying medicine. You did an MD PhD, so you were doing a research-based study, and it was sort of, I guess, coming up to halfway through that when Geneoscopy came into being. Normally, although not always, what we kind of find is that there's a period of some length of kicking an idea around and talking about a concept and going backwards and forwards over whether it's the right thing to do, and then something happens, whether it's a conversation or an opportunity or whatever, and that sparks it into life. And I guess, I can't imagine being halfway through a medical degree is a non-intense time to start a company. So
doing a couple things.
Yeah, exactly.
We had the medical training that I went through. It was 2 years of didactic learning where I'm in a classroom and I just get a breadth of knowledge, right? So I'm learning disease, I'm learning healthy, and that's kind of where I conceptualized the idea for Geneoscopy. And then I entered my PhD. So I did a computer science PhD. It was a dry lab. I was learning how to code, learning how to process sequencing data. And that's kind of what you're describing, where I really started building the meat of Geneoscopy and raising some money. And that's when Andrew, my brother, joined and became the CEO. And we were really building kind of a tangible product. It felt a little bit more real than just, doing a business competition and pitching around. And we actually launched our pivotal study during that time.
Yes.
And so I completed my thesis, graduated from the PhD program, and I took a couple of years off because, like you said, it's a lot to run a company and a phase 3 pivotal study, and doing my education. I got married at the time, and I got pregnant with my first child. So kind of running all that, personal and professional. And then I re-entered the medical clerkships, where you rotate through various kind of, nephrology and medicine and surgery. You kind of rotate. And that's when it kind of became real. That's when we started applying for FDA approval. That's where we raised our Series B. We built a CAP-CLIA laboratory, and we were processing real samples, and we were having real patients. And that's kind of the moment when I realized I'm not going to be a doctor. Yes. I'm not going to be a PI. I'm not going to be in academia. I'm, making that leap towards industry. And it was scary because, you have this very secure, safe path and job security, and leaping into the world of entrepreneurship is very scary, but I'd say it's obviously the best decision I made. I got to do it with my brother, and we have an amazing team, amazing lab, and we've already started helping patients. We have an FDA-approved product, and we're out there, and we're partnered with LabCorp, and I can just see the the younger version of myself is very, very proud of the person I became today, because I think that was the vision for me.
Yes. Well, that's always a good thing to be able to say. And was it a decision, or was it kind of once you realized that was happening, it was obvious that that was the path, or was there any point of decision there?
Yeah, I think, how I view it is you're always, in your younger years, you're always opening doors, right?
Mm-hmm.
You're increasing your opportunities with your education, with your experiences, with internships, with your interests. You're pursuing a variety of different things, and you're opening doors for yourself. And I got to a point where I realized I started closing some of those doors, right?
Okay.
And it's a slow process, but you wake up one day and you realize, I don't think I'm gonna be able. The residency applications are closed,
yes.
And all my friends are going off and doing those programs, and I'm not. So I don't think there was any aha moment, but
Mm-hmm.
I did realize that I started getting to a place in my life where some of those opportunities were closing, and the path for my career was becoming a little bit clearer. It was definitely the path least taken relative
Yes.
to the people I was in school with, but a very fun and exciting path for sure.
Yeah, absolutely. I'm sure you've been asked this before, but I have a brother, and I think and this is not a criticism, it's probably more a criticism of me than it is of him. I think if we tried to build a company together, it would be an absolute car crash. Everyone's relationship with their siblings and family are different, of course, but that's an interesting choice to make, I suppose, or an interesting path to pursue.
Yeah, so it's funny. Half the people say, I would have loved to start a company with my sibling. And half like, are you crazy? Are you insane? So definitely it's a dichotomous split. But I'd say Andrew and I are so complementary in our background. Him in the business field, having private equity and investment banking experience and an MBA. Me in the science field with my MD, PhD, and my pipettes and my lab. And I think those skill sets are very complementary. Our personalities are very complementary. He's more nervous. He keeps us out of the gutter. He, makes a path and understands and identifies minefields and, keeps us straight and narrow. And I'm the happy-go-lucky, like, we can do this. This is going to be great. It's going to be fun. Rally the troops. Very, positive personality. And I think that balance has made us successful, making sure that we're complementing our skill sets with a personality that's very even-keeled has been really good for the company in the highs and in the lows equally. So I think that's why it works. And we really trust each other. I think that's the best part about this is you're building something with somebody you trust and love, and I really enjoy it.
Yeah, I was going to say, I think, one of the key elements of success in a partnership, a business partnership, is trust, right? And, I suppose you're not going to have more evidence of trust than you will with someone you've grown up with your whole life, right?
I know. And I think you can sense with your siblings too, you can sense when there's something wrong or when there's something off or whatever. And I think, being an entrepreneur is very isolating. You have to keep a lot of the information internalized and make sure you're disseminating information in a way that keeps the troops rallied and make sure that you're kind of being strategic and thoughtful, and you bear a lot of the burden. And so being able to share with Andrew and with each other and supporting each other through everything has been really great.
Yeah, understand. So tell us a bit about the journey to this point, because, you've made fantastic progress. As you say, you've got FDA approval, you've got patients, you've got partnerships, you've got all the things that a real grown-up business has. What I suppose, what are your memories of the early days? What are your memories of the things that were great, the things that were not so great, the things that surprised you? Sort of take us back to the beginning a little bit.
I think, I always say it's going to be really exciting when we're revenue positive. And Andrew's a finance person, right? He's like, Erica, revenue positive is not a thing. You can set up a lemonade stand and sell a lemonade and you're revenue positive. Like, that doesn't mean anything. But in the biotech world and the healthcare world, it actually is meaningful, right? To go through ideation, concept, feasibility, to go through a 10,000 patient prospective clinical trial, to submit that to the FDA, to get FDA approval, to start selling tests, on the other side 8 years later, we're revenue positive now. And I think, we'd always envisioned the regulatory pathway and the hurdle associated with getting FDA approval. I think what we maybe not underestimated, but didn't have a severe appreciation for was the things that surround that. Right. When we were 8 years ago, we were squatting in a incubating lab and borrowing centrifuges and pipettes from our neighbors. And, we were leveraging our connections and our resources and our advisors at WashU to kind of help and supplement everything. Even just building a collection kit that we can ship to patients and ship back, that took a number of years. Building a lab during a pandemic, that took an inordinate amount of time and effort and thought. Building this decentralized clinical recruitment model where we didn't set up sites at endoscopy centers, that had never been done before. And creating that infrastructure, to navigate patients to colonoscopy. We didn't have an appreciation for that until we started just, getting our feet wet and making attempts at doing it and being unsuccessful in the first couple of tries, and then iterating on that and being successful later. So I think beyond just the regulatory pathway, it's product development and fundraising and IP and, building your team, and all those things need to kind of come together at the same time and all be successful for a company to succeed.
Yeah. Yeah. And I suppose one of the themes that comes up quite a lot. So I remember being at a conference years ago, and someone quoted a guy called Bill Hain, who was the head of R&D at Janssen, as saying that, 100 years from now, this is about 5 years ago, 100 years from now, people will look back and say, what, they waited until people were sick and then they did something about it? This whole move towards preventative healthcare, right? The problem has always been getting people to pay for prevention, and that's something that you're having to navigate as well. Talk a bit about that. That'd be interesting to explore.
And I think that was another thing that, you think about, right? But our eyes were so focused on FDA approval, which we received about a year ago. And we're like, oh, okay, reimbursement, we'll figure that out. But especially in diagnostics, like you're describing, this valley of death between approval and number of lives that are covered for your test is tough. We have a very fragmented healthcare system, whether it's Medicaid, Medicare, private payers, all of that, each one of those individuals across all 50 states, there needs to be negotiation of contracts to be covered and to demonstrate utility and clinical benefit and all those things. And so for us, we've been focused on the last year of patient access and market access and making sure that that's getting done. And I think especially in the, with the administration change and the new rules and, things are coming out daily that are changing a landscape that has been, pretty set in stone for a long time. And so just navigating those waters and that change, moving goalposts has been challenging, but I think we're doing a pretty good job and just then one foot in front of the other. And I think it's a great test, and I think it's a great need, and a lot of people recognize that. And so that's been to our benefit in terms of getting payers to recognize the value of ColoSense. Yeah.
Yeah. And I think the volatility that you're talking about is really interesting, right? I think it's at a higher level of change and a higher, a sort of more rapid change than really we've seen for years and years and years in so many different elements, right? Especially in the US with all the policy changes, but around the world with the economic changes, political changes, societal changes that we're seeing. And I don't know, I speak to entrepreneurs about this regularly, and some of them
They say
are still experiencing a bit of whiplash, and some of them have sort of reached a point of acceptance where they're kind of going, hey, look, let's see what happens this week.
that is one of the biggest benefits about being an entrepreneur. You know, I'm used to this. I'm used to the upheaval. I'm used to the turmoil. I view it as an opportunity, right? If there's change, there's opportunity, and we can take advantage of that, and we can use that and use it to our advantage. I think Geneoscopy is still young. I think we can pivot. You know, we're not a big cruise ship that can't steer in tumultuous waters, and I think that we can use to our advantage. We've been very agile, and we've put resources where we need to put resources to kind of move in the direction that we need to move. And we rally a team behind that who's very passionate about the work that we're doing. And I think that's just played to our strengths as a small, agile company.
Yeah, absolutely. You touched on this earlier, that the first sort of chapter of the company's life was all about product development and about regulatory approval, and I think that's where a lot of people focus when they start, right? And they should, and those are the biggest hurdles you've got to overcome. And now you've moved beyond that a little bit, and I'm sure there's still an element of that. I'm sure you're still iterating and looking to the future. But how do you think about the company now, having overcome that first set of hurdles?
Yeah, I think that's another big, it's a transition. And I'd say that the people who got us here might not be the same people to get us there. And so that's been a big transition as well, kind of recognizing, the people that were really good at product development, but maybe struggle on the commercialization side, or really good at research and development, but aren't necessarily the people that we need in our CAP-CLIA laboratory processing samples every single day, and just shifting the company around and putting people where they're kind of playing to their strengths, building out our sales force, building out our commercial team, building out our marketing, market access, all those things we just didn't need. And I think, we're working towards kind of being successful on the commercialization front, like we've been on the product development front. Yeah. It's a challenge. And I think the biggest challenge is again, making sure that the right people are in the right place and supporting those people with the resources they need to kind of be successful. And just recognizing that, market access, commercialization takes just as long, if not longer, than the product development. And that there's a lot of components that are outside your control, right? I can't get Dr. Oz to be confirmed more quickly. And MS is saying they're waiting for that to happen. And so that's completely outside of our control, and trying to recognize what can we do in the background, what can we pull in and make part of our control, and how can we prepare better for when those external factors come to fruition. That's just been a mentality change, I think, for the company.
Yeah, I can imagine. And I imagine there's also interesting cultural shifts that happen. And I say this with love because I'm a salesperson by background, and I've run sales teams for years and years, but salespeople can be challenging and different to R&D and product development people. And, there's always an interesting transition that happens in that you want to retain the essence of the company, the sort of core of what makes you who you are. But then you have to bring in these people with very different mentalities, not just the salespeople, but everyone else that kind of makes a company a commercial entity, right? That must be an interesting terrain to navigate.
Yeah, I think it's funny you mentioned that. So culture has been a huge part of the Geneoscopy fabric from like the beginning. And I think that's a really important, it was very important to me and Andrew. I came from medicine, he came from finance. Those are notoriously difficult fields to be in from a culture perspective, from a very hierarchical perspective. And so, when we started Geneoscopy, we wanted to be flat. We wanted to be transparent. We wanted our employees to know why they're here and what they're doing, and feel passionate about it, and use that to drive hard work, not things that are traditionally used in medicine and finance. And so that was really important to us. And with that, we started doing things just for culture. We all take personality tests, and within our groups, within our cohorts, we talk about it. It's kind of like Harry Potter sorting hats. You get sorted into your own quadrant, and you learn about your strengths and your weaknesses and things like that. And to your point, all of the scientists cluster in the blue. All of the HR people are over in yellow. All of the sales people are in the green, not for money, it's for something else. But and then there's a couple of reds, and I'm a red. I'm the bull in the china shop, the decision maker, and trying to make sure that you're speaking to the blues in a way that they understand and hear you. Trying to make sure yellows are comforted, that the greens are feeling motivated. I think all of that has been really helpful. And since that's something we started way back in the beginning, and people here just feel very passionate about that, feel heard, feel like they get to contribute, and that their managers know who they are and what makes them tick. I think that's been really, really helpful for us. So I always say culture is not expensive. It's just time consuming. And the earlier you can start building culture at a company, the better off the company is going to be.
Yeah, absolutely. I mean, obviously I'm on the same page as you. This is what we do. So I'm very aligned with what you're talking about here. But you're absolutely right. It's usually not very expensive, but it does take time to figure out what to do. And everything else is always more urgent, right? Until it's not, and until that's the most urgent thing. And then it's usually too late. And that might be one of the things, but I normally find that, especially over a sort of, the time period you've been running, over an 8-year period, there's usually a handful of things that kind of have been core to making a company successful, whether that's a handful of decisions or a handful of sort of elements that exist within the company. When you look back on the journey so far, are there key things that you think have really enabled the progress that you've made?
Yeah, I think it is a mindset. There's two components, I think, to the company, and what from a top-down perspective that we assume that made the company very successful. So it's kind of the saloon door approach, where a decision is better than thinking about a decision, right?
Yes.
Perfection is the enemy of done. And making sure that those decisions are in-out. You can always recover from them. So whether it's, making a hire that ultimately was not the best fit, and either relocating that person or trying to transition them out, whether it's kind of partnering with somebody, but making sure that the contract is set up in a way that aligns interests, and that there's, some kind of exit, whatever it is. Those are just a couple of examples, but making sure that we are constantly making decisions, that meetings are decision meetings, that we're brainstorming meetings, that we're actually doing things and moving things forward, and not just thinking about things, I think has made the company very successful. And then I touched on this briefly, but being a flat organization, especially when you're young, where everybody knows what's going on. Our youngest and least experienced employees have the same amount of information as the C-suite, and that they know what they're working on. They know why they're working on something. They see the end goal, they're contributing, they're making, they're the boots on the ground. So they're the people who actually know what's going on and can provide solutions. And again, that kind of keeps us out of the gutters. I think listening to people and hearing their thoughts and what they're worried about, regardless of their position, has made the company really successful in that we can anticipate things. And instead of constantly putting out fires when it's too late, we're preventing them from happening. And I think that's been really important.
Yeah, that makes total sense. And I imagine your job is very different now than it was 8 years ago. So you will have had to develop, and you will have had to learn, and maybe learn new skills, but also sort of shift your perspective and widen your worldview and all those things that happen. What have been the most important things you've learned over that time, do you think?
I would say I've never had a real job. I trained until I made a job for myself. And I've been doing that ever since. I think it's weird to be, the youngest person in the room, but the person that everyone's kind of looking up at. And, it's looking out for what are we doing next? What's next? What are we doing now? What are you thinking? It's weird to manage people who are older than me. I think, like you're describing, every day I try to learn about myself and about my directs and my team. And I think with time, and especially with motherhood, becoming a mother kind of definitely made me a better manager and hopefully a better leader. Just learning patience, learning kindness, learning how to see people and their problems and their needs, seeing the whole person, not just the person that shows up from 9 to 5, and making sure you're helping that person through what they're doing at work, but also, their personal lives and what they're managing at home and their stress levels across that spectrum. I think recognizing that, a person is a person and not just an employee, I think has been really helpful for me. And I think people like that, right? People want to be managed by a person, not a robot. And it makes for a very good, trusting team. And I think, again, that's part of our culture. It's been who we've wanted to be as a company. And I think we've been hopefully pretty successful on that front.
Yeah. It's interesting you mentioned being a mother and the relationship, because I think about parenthood in this context quite a lot, in that when you're a parent, you kind of take the two, and I say this in inverted commas, easy options off the table, right? You can't fire them and they can't quit. So you've got to find a way to make it work, right? And I think, and also, especially when kids are younger, I don't know how old your kids are, but there's a lot of emotion. There's a lot, they get very emotional about stuff, and it's very intense and big, more so than in work usually. So dealing with all of that, I think, gives you different tools in your toolbox to then take into the business. And not to say that your employees are like children, and I have to be careful about the analogy that I use when I talk about this, but I do think they're things that they both make you better at the other one, I think.
For sure. I mean, my kids are 2 and 4 months, so or 5 months. Yeah. We're in the big feelings arena right now. And I think, no, you're so right. They're not kids, but you use the same tools to, talk to. You should be talking to your kids like they're adults, right? I think it's the opposite, more that I don't talk to my kids like they're kids. I'm like, man, like, you had a rough wake up from that nap. I'm sorry. Like, how can I help? You should be saying that same thing to your employee, right? Like, oh gosh, you're a little late today. Is everything okay? Instead of, why are you late today? Like, why aren't you on time? Just approaching a conversation with a little bit of empathy goes a really long way. And you have to do that, like you said, with your kids, because you can't kick them out. And having that repetition at home and then bringing that energy and that empathy to work has I hope, made me a better leader.
Yeah, I think you're right. I think appreciating the other person, appreciating that there are other factors at work, and assuming good intentions is a good place to start from, right?
I think everybody could use a little bit more kindness in this world. That would be great. I would love for people to take that away. That'd be awesome.
Yeah, absolutely. And you might have touched on this already, Erica, but if there's one thing that you know now that you wish you'd known 8 years ago, or if you bumped into yourself from 8 years ago today, what would be the one or two things that you'd pass on as pieces of advice?
Yeah, I don't know if this applies this probably applies to just everything, but it's never as good as it seems, and it's never as bad as it seems.
Yeah.
I think that is something you learn over time, and try to keep that even keel and recognize, let's just give it some time. I think people make emotional decisions. I think I've made emotional decisions where you think something's catastrophic or something crazy happened, and you don't give yourself a breath, and your sympathetic nervous system goes into overdrive, and you start just trying to fix. And being able to stop yourself and say, I'm having an emotional response to this. I need to give it a minute. I need to go, take a shower and think about it, or go for a walk, or whatever it is, to just level your head and make a decision kind of in the absence of that sympathetic response. I've gotten better over time, I'd say. But I think, God's working on all of us, and that's definitely one of them that I try to fix things too quickly. And I think giving it some breath is really important.
Yeah, I think it's a really important point. And I think the stakes get higher as you move along, right? So even though you kind of learn the muscles to deal with that kind of decision, it increases in intensity, or in the size of the consequence over time. So keeping that in mind, that it's probably not as bad as you think or as good as you think, is a good place to be.
And I also think that the other, really big one is whenever something goes wrong, being like, how did I contribute to this? What did I do wrong? Is this my fault? Whether it's in your personal life or your professional life, if there's a problem in the lab, your first impulse is to be like, what'd you do?
Yeah.
My kids, I'm like, what'd you do? Or, being able to say, like, did I set that person up for success, or did I set that person up for failure? And taking ownership. I think that's a really important thing to kind of break and try to approach conversations as like, what can I do, or what should I have done to make this outcome?
Yeah, absolutely. And it sounds like a very exciting time at Geneoscopy. Tell us a little bit about what's next.
There's so much. I used to tell people that I have, we did our pivotal study, and I think that was, we were heads down, focused on that. And I've looked up, and now I have this massive laboratory with these unbelievable scientists, and I have 11,000 stool samples sitting in my laboratory, all in freezers named after Star Wars characters. And I'm in such a great place for research and development. I feel like Willy Wonka in a chocolate factory. Just there's so many things to do next. So we're very focused on a successful launch for ColoSense. We have all these biobank samples to develop our next generation test in the colorectal cancer space. We've partnered with a number of pharmaceutical companies to start exploring therapeutic response for patients with IBD that I'm very passionate about, and we're hopefully going to be launching our second test in the IBD space kind of within the next year timeframe.
Fantastic. Well, we wish you the best of luck. Thank you so much for joining us, Erica.
Absolutely. Thank you so much for having me.
Thanks for listening. If you enjoyed the episode, please like and subscribe and share it with someone else you think will benefit. And for more podcasts, videos, blogs, and insights, come follow me, Tom Froggatt, on LinkedIn, YouTube, Instagram, Medium, or TikTok. See you next time.